Okay, I'm going to go ahead and turn it over to our opening presenters. Let me just remind folks that throughout the broadcast, you are free to send your comments and questions in through the chat window. There's also a Q&A option. We will do our best to respond to those questions at the end of the broadcast. And if whatever we don't get to during the webinar, we will make sure we respond to after the program finishes up. We'll do a follow-up email to everybody with the answers to your questions. So please feel free to send your comments and suggestions in throughout the program.
Hi, I think that's my cue to start, correct?
It is.
Hi, good afternoon, everyone. Thank you so much for taking the time to join me, our Maine CDC, and our partners here on the call today. I'm Dr. Va, and I'm the director for the Maine Center for Disease Control and Prevention. I'm really happy to be joined here today with our team members here. I am joined with Maureen Carland with the Maine Health Care Association, as well as with Nicole, who will be providing introductions with long-term care ombudsman. Before we start, I just want to send my thank yous to everybody who's joining us on the call, and also to our partners who have contributed to bringing this webinar to you today. It was a concerted effort across multiple groups. We have DHS partners on the call here, as well as the Commissioner's Office, Maine CDC, as I mentioned, our DHHS Office of Aging, LTC Ombudsman, as well as with the Maine Health Care Association and the Power of Care campaign. We are all here because we care for and serve a very special vulnerable population. And I hope that the information shared today will strengthen our coordination efforts to truly protect one of the most vulnerable populations in our community during this respiratory season. I want to start with framing for the audience today and for you today, our relationship with COVID-19 as it stands today. There have been a lot of changes, but in some ways, things have not changed. Although we are no longer in the public health emergency phase of this pandemic, this surge right now continues to underscore some of the things that have not changed. What we know is that COVID-19 continues to place a huge burden on our communities and our healthcare systems. That is still happening now, unfortunately. The surge that I just mentioned that's happening right now, that situational awareness will be brought to you by Dr. Benowitz, and he will highlight this in more detail later. But what we know is that it continues to be here. It continues to come in waves that are still not quite what we call predictable. It still places more burden on the health of the public than RSV and flu. What we also know is that the most vulnerable still remains the most at risk. So when we look at those that are coming to the emergency room, folks that are being hospitalized, and unfortunately, folks that are dying from COVID-19 today, it still remains those that are older Mainers. That unfortunately has not changed. What we also know is that we have effective, up-to-date vaccines that are effective against the current strain right now. We know that we have effective treatment with early testing and identification. And we know what mitigation tools work, such as masking and ventilation. These things still ring true today. So what you'll hear today is that you'll hear updates on the status of COVID-19, the latest vaccines and vaccine rates, infection control mitigative steps recommended by US CDC and also by our partners on the call today and by Maine CDC. And these are steps that we can continue to take to really protect our staff and the folks that we serve. You will also hear about the Power of Care campaign and resources that are available to you so that we are here to support you, and that these resources are there to support you as well as we navigate through this respiratory season and to take some steps to prepare for even next year's respiratory season. And so with that being said, again, thank you so much for taking the time to join us. I think this is a really important webinar. This is a really important time because we know risk is high right now. And I want to go ahead and hand this over to my partners on the call, Maureen and Nicole. Go ahead, Maureen.
Thank you. Thank you, Dr. Va. I'm really thrilled to have you here today. And I hope that as you continue to get to know the incredible people in our homes and in our centers that take such outstanding care of our older adults. They really are. We're fortunate in the state of Maine to have some incredibly dedicated people. For those who I don't know, I'm Maureen Carland. I am the Director of Quality and Regulatory Affairs here at Maine Health Care. Many of you know over my years as a nurse as well as a nursing home administrator. So I'm very familiar with the challenges that have been faced during the pandemic. I believe we can all agree that the pandemic was one of the most challenging times in our careers. In the pre-vaccine time, we had a lot happening. We had people who were very ill and who were dying. And we really felt as though we could not provide them the care that we wanted to. We saw people die that are the reasons why we all came into this field, to see the people, the residents that we all care so much. And it was just such a most difficult time for us. Well, now things have changed. The public emergency has subsided, but as Dr. Va said, COVID-19 is still a reality. So today presents us with a great opportunity to come together to lay the foundations for our continued commitment to caring for our residents who hold such a special place in our hearts. So looking forward to working collaboratively to ensure the well-being and provide exceptional care that they provide. And I'll turn it over to Nicole.
Thank you, Maureen, and thank you everyone for being here today. My name is Nicole Marchesi. I'm the project manager for the Power of Care, a resident-focused vaccination campaign. This project is being implemented by the Ombudsman program in collaboration with the Maine Health Care Association and Maine CDC. You will hear from me later in the webinar about this campaign and how we can support your efforts in protecting the very vulnerable population that you serve through vaccination. We greatly appreciate the care that you provide to residents, and we know that the pandemic has presented all of you with many challenges. So thank you for being here today. And with that being said, I'll hand it over to Dr. Benowitz.
Hi, everyone. I'm Isaac Benowitz. I'm the State Epidemiologist and Chief Medical Officer at Maine CDC, and I'd like to share a little bit of information with all of you about what's going on right now with respiratory diseases in our community and nationally. Next slide. So, big picture, there's a lot of respiratory virus disease activity in the US. This map charts what's known as influenza-like illness. So this is not specifically COVID-19, but this includes COVID, flu, RSV, and other respiratory diseases. You can see that in many states, activity level is high to very high. Maine, this was as of about 2 weeks ago, Maine was sort of on the cusp of moderate to high. But really, I want to highlight there is a lot of respiratory virus disease going on across the country. Next slide, please. I want to drill down and talk a little bit about COVID and flu hospitalization rates, because this really speaks to the severe disease that we're seeing. And these are people with severe disease who are placing a burden on healthcare facilities, on acute care facilities, and are at risk for very severe disease. So this is US data on the left, Maine data on the right, COVID in orange, flu in blue. And what you can see is that last winter, we had very prominent surges of COVID-19 and flu, both nationally and in Maine. And this year, again, those are both climbing. On the next slide, you can see that we're also watching RSV hospitalization rates. These data are a little harder to come by, so we don't have this at the state level. There are certain states that are collecting more detailed information, but you can see again a sharp peak of RSV hospitalizations last winter and climbing again this winter. That dip in the gray bar, those are preliminary data, and so we expect that while the data do wobble a bit week to week, these are still high numbers. Next slide, please. I just want to highlight what's going on with deaths from respiratory diseases right now. While both flu and RSV and COVID-19 are all leading to outpatient visits and emergency department visits and hospitalizations, it's overwhelmingly COVID-19 that is killing Americans right now, including our most vulnerable in nursing homes. Next slide, please. Taking a closer look at emergency department visits, for most of the past year, it's COVID-19 that caused the most ED visits nationwide. And it's just in the last few weeks that influenza overtook that. But we can see that even in the last few weeks, COVID, flu, and RSV are all causing substantial numbers of emergency department visits. In the next slide, you can see these numbers broken out by age group. And I put this up here to highlight something that I think is important for all of us to be aware of, maybe a little bit less in nursing homes, but it's important to recognize that a lot of this respiratory disease is in infants and young children, and it's really across the age spectrum. So a lot of the most severe disease are the older adults and the youngest infants, but there is impact to the healthcare system from all of these age groups. Next slide, please. And then just looking at overall COVID-19 disease, these are based on hospital admissions levels. You can see that most of the country is in the yellow and green zones. Those are a little safer, a little bit more under control, and some parts of the country are already tipping into orange. Next slide. I want to take a moment and drill down and talk about what's happening with COVID-19 vaccine in nursing home residents and staff nationally and in Maine. These data are collected by CDC every 1 to 2 weeks through the National Health Care Safety Network. So I really appreciate all of you who are taking the time to report those data in, because it helps us understand what's going on. So in the week ending January 7th, so these are data reported about 2 weeks ago, and those cover a period that was a week or two before that. So in that period, nationally, 38% of nursing home residents are vaccinated against COVID-19 with this year's COVID vaccine. And in Maine, that is 39%. So yes, that puts us above average, but it still puts us solidly mid-pack. About half of the states, more than half of the states are actually doing better than we are. And I'll drill down to this in a little bit in a few slides, but I do just want to highlight there's a really wide range. The lowest performing state was at 13% and the highest was at 66%. On the next slide, we're going to transition from on this slide, I want to just show you where we are in the pack. So about more than half of the states have higher rates of nursing home resident vaccination for COVID-19 than we do. On the next slide, I want to show you nationally and in Maine what's going on with long-term care facility staff. So the national numbers were not calculated this past week because the calculation method changed. What I do want to highlight is that Maine is at about 12%. You might look back a column and say, oh, we jumped from 6% to 12%. But what actually happens is that they changed the way these numbers are being calculated. You can see the highest performing state is at 50% and the lowest is at 9%. And if you go to the next slide, what you'll see is here's where we are in the pack. Almost every state in the country has better nursing home vaccination rates for COVID-19. This tells me there are a lot of barriers here, but it also tells me there are a lot of opportunities here. I know that we'll get into that in a bit more detail. On the next slide, just wrapping up here, this is not state by state, this is facility by facility. So this is the percent of residents that are up to date for COVID-19 vaccine facility by facility. And I want to highlight a few things. There's only one facility in the entire state where every resident is up to date with COVID-19 vaccine. Around a fifth of the facilities in the state reported that no residents are up to date for COVID-19 vaccine. And then in between those, there's quite a range. So I'd say over a quarter, maybe upwards of a third of facilities are reporting under 20%. About a third are reporting 30 to 65%, and then a third are reporting, let's say, 65% up to about 100%. And if we go to the next slide, you'll see a similar breakdown for nursing home staff. And so here we're seeing a lot of challenges as well. So again, this is facility by facility. You can see that almost a quarter of the facilities reported that none of their staff are up to date for COVID-19 vaccine. This means a lot of opportunities for staff to bring COVID-19 vaccine into the facility. It means a lot of opportunities for staff to be out sick due to isolation for COVID-19. I'll highlight that there are only 3 facilities that beat out 95% of vaccination for their staff, and only 1 more that was even over 35%. So again, a lot of challenges, a lot of room for opportunity. I think that's my last slide. So if we go to the next slide, I'm going to hand this over to Carrie, Lynn, and Maureen to talk a little bit about some of the guidance for infection control policies and risk assessment. Thank you.
Carrie, you want to go ahead and start?
Actually, Lynn's up first.
Oh, okay.
Lynn, it looks like you're talking, but we can't hear you. You might need to switch your mic. Still can't hear you.
Minute. How's that? Can you hear me?
You got it. Yeah.
Excellent. Okay, thank you, Dr. Benowitz. My name is Lynn Hediniak, and I'm the Associate Director for the Medical Facilities Unit within the Division of Licensing and Certification. We're the folks who actually go out and survey nursing homes, and we follow the state and federal regulatory requirements. Those regulatory requirements are set out by CMS. We could go to slide 18, please. Thank you. The last time CMS talked to us about infection prevention and control policies, it was in May of 23 in a QSO that had been issued much earlier, but was revised in May of 23, and that is QSO 2039 nursing home. In a nutshell, and I didn't write it this way, but essentially, the CMS kicked the ball down the field to the US CDC, which is why Carrie and I are partnering on this. Carrie has all of the US CDC stats and the Maine CDC information on the next two slides. The emphasis that CMS is putting out on infection prevention and control is what they call the core principles. And you will find that on page 3 of that QSO. And the CMS advice is that all of those core principles, including the new one they added about posting signs for visitors, staff, and residents to see, are consistent with the US CDC guidelines and should be adhered to at all times. And that was bolded and underlined in the May update to that QSO. Staff and resident testing is still a part of core principles, but the CMS group are referring us to accepted national standards such as US CDC recommendations. And with that, I'll turn it over to Carrie Rice.
Hi, thank you. You can go to the next slide, please. My name's Carrie Rice. I'm the Healthcare Epidemiology Improvement Coordinator here with the Maine CDC. And so we'd probably need a whole webinar ourselves just to go over all the guidance. So I wanted to take a moment to really focus on a more broad picture of respiratory viral infection prevention and control. And really what needs to happen is facilities should have an overall comprehensive respiratory viral illness prevention response plan. This plan should have the ability to scale up and scale down. And it helps to have a defined framework to lean on, but also has the adaptability to respond to current situations. And so what you will see on this slide are some of those major components to think about. Things that you've probably heard before and you very well could already have plans for. So things like respiratory hygiene and cough etiquette, source control when appropriate, how you are going to identify sick individuals, prompt implementation and appropriate discontinuation of transmission-based precautions or isolation precautions. Communication during transfers, both when you're receiving residents or when you're sending residents to another institution or hospital, appropriate personal protective equipment, hand hygiene, your environment of care, cleaning, disinfection, waste, those environmental services, vaccination, which others will talk about. Do you have policies for if you have a healthcare worker who's been exposed, who are sick, prompt testing and surge planning for if you were to have more than one of these organisms at one time? So we do have down at the bottom of this slide links to various different recommendations. And if you have any questions in any of these, you can always reach out to us to ask more. If you go to the next slide, please. So this isn't necessarily infection control guidance in the sense of what to do for different organisms, but we wanted to bring back the idea of performing a risk assessment because there may be times that you can't meet the golden standard or you need to figure out how do I do this? And so a risk assessment examines a process in detail, including the sequencing of events of actual and potential risks or failure points of vulnerability. And then it prioritizes them through a logical process. So you can find the areas for improvement based on the actual potential impacts to care, treatment, or services provided. It's highly recommended to perform a proactive risk assessment when you identify there could be a potential process vulnerability or a high risk process action or event that could result in poor outcomes, and or maybe there's no prescriptive guidance or regulation out there, the gray areas in infection control. And so how this works is first you have to identify what is the problem, identify the risks. Then we have on the side here, it's just an example of a template that you can get access to on the link down on the bottom of the slide. I have a long video tutorial that goes over this in more detail, but also access to some of the tools. And it works through the process. So you identify the issue, then you got to go through, okay, what are the reasons this issue should continue? What are the reasons they should not? That risk profile. Once you make a decision on, is it going to continue? Is it not? Then you've got to detail out, okay, what is our risk mitigation? What are we going to put in place to decrease the risk as much as possible? You want to identify what could be all those possible effects, the scope, the seriousness of the issue when you make those risk mitigations. Then once you put those mitigations in place, do you need to change policy, practices, and educational platform? How are you going to ongoing monitor this to see if it's effective? And as you're monitoring, what's your time frame for reviewing this to see, do I need to circle back around? It's not working, it's working well. Do I need to change something? How might we do this again in the future? And the other thing to think about in a risk assessment, and this comes up a lot, is when you perform a risk assessment, it doesn't remove the risk. It is an awareness of the risk so you can take actions to decrease it as much as possible. So like I said, really check out the tutorial to give more detail on how to exactly work through this. I use the example tool. And if you have any questions, you can reach out to us for more information. And I believe, Maureen, you wanted to give potentially a little example.
Well, no, I love your example, Carrie. I just wanted to say this is a great tool. I have used it many, many times during the pandemic. It is something that I would encourage everybody to use as frequently as possible. Look at the tutorial. You can adjust this. This is, this is not, you don't have to follow every single one of these steps. If there is a way you want to tweak it that is better for your center, that's absolutely fine. What's another great purpose of this tool is communicating. Because sometimes you have your director of nursing, your administrator, your medical director, who maybe make a decision about a risk, but it doesn't get communicated to people. So they don't understand how you made that decision and that determination. It's another great way of communicating with the rest of your team so they know what you were thinking. And they can provide a lot of feedback as well. So I can't encourage you enough to use this form. Every day and everything you do, it can be done very easily and quickly. At first, I was intimidated by it, but it's a really simple tool, so use it. Thanks, Carrie, for developing it.
Yeah, you're welcome. One of the final thing is it does provide you the documentation of what you did and your plan, which can also be really helpful because we know if you didn't document it, you didn't do it. And, the communication is very important as well. So yes. And we will hand it back over to Dr. Benowitz, I believe.
Great. Thank you so much for going into all that detail. I find that approach so helpful, and I hope that everyone else here does as well. If you go to the next slide, I just want to highlight some information that we put out through our Health Alert Network a few days ago. If you don't already receive these health advisories, please take a moment today to sign up for the Maine Health Alert Network at mainehon.org. So this message that we sent out last Thursday highlighted that we recommend masking and vaccination in healthcare facilities during periods of increased respiratory virus activity. And this is not just nursing homes, this very much applies to hospitals and other healthcare facilities as well. Next slide, please. I'm just going to highlight a few things. So big picture, and this is very much what I'd already shared earlier in the call, respiratory viral illnesses, including COVID, flu, and RSV, have increased nationally and locally, and they are straining hospital capacity. Vaccines and treatments are crucial to reducing the impacts of respiratory viral illnesses, and rates of COVID, flu, and RSV vaccine are low nationally and in Maine, including in particular in nursing facilities, as I shared earlier. Source control, use of masks or respirators to reduce spread from the wearer, remains an important intervention during periods of higher respiratory virus transmission. Next slide, please. So what do we do with all of this? Based on all of that situational awareness, Maine CDC strongly recommends that healthcare facilities promptly enact policies and processes for broader use of source control during periods of increased respiratory viral activity to prevent strain on healthcare resources. And these can include the use of source control during patient encounters or at all times inside of a facility. And that could be facility-wide or unit-specific based on disease metrics in the community and in your facility. Second, we remind you to follow disease-specific guidance for the use of transmission-based precautions, including the use of PPE, and for the management of patients and residents with suspected or confirmed infections. Next slide. We also encourage you to consider policies that encourage your staff to stay up to date by getting the 2023 to 2024 COVID-19 vaccine in addition to the annual flu vaccine. I'll note a few things. One, COVID-19 vaccine is recommended even for people who recently had COVID-19, and certainly for people who had COVID vaccine is recommended even for people who have been vaccinated and even for people who have been recently infected. I think I got that right. And I also want to highlight that there's no waiting period required between the COVID vaccine and the flu vaccine, or between COVID infection and COVID vaccine, or between COVID vaccine and RSV vaccine. And finally, I'll just reiterate in broad strokes what Lynn and Carrie and others here have shared, which is that preparing for and responding to respiratory viruses requires a comprehensive approach, including infection prevention and control, testing, vaccination, and treatment. These help to reduce transmission of COVID, flu, and RSV and protect patients, residents, staff, and visitors. There are a wide range of different metrics that you could look to. We really leave it to you to determine what is best. But if you don't already have some way that you're responding to what's happening in the community with these diseases and what's happening in the facility with these diseases, this is really a good time to take a step back and think about how you can use that to inform your decisions. Next slide. And I will hand it off to Camille, Kate, and Caitlin from the Maine Immunization Program to talk a little bit about the current batch of available COVID-19 vaccines. Thank you.
Hi, everyone. Thanks so much, Dr. Benowitz. I'm going to cover the 3 different types of COVID vaccines that are now available, as well as the insurance coverage. And then I'll hand it off to Camille. So currently there are 3 COVID-19 vaccines available, with the Novavax being the only non-mRNA vaccine. All 3 have been updated to include the XBB lineage of the Omicron variant, which could provide additional protection against severe COVID-19 that may have decreased over time. No one vaccine is preferred over another. However, we only offer the Moderna vaccine through our Bridge Access program. So insurance coverage. All insurance providers and plans are required to cover COVID-19 vaccines and their administration without a copay. And that's if they're administered, even if they're administered by an in-network provider. There are only a few insurance plans that have been grandfathered in and may be exempt from these requirements. Therefore, they may charge a copay for the COVID-19 vaccine, even if it's within an in-network provider. Medicare Part B, including Medicare Advantage plans and Medicaid plans, both cover COVID-19 vaccines without cost sharing. Under and uninsured individuals 18 years and older are eligible to receive a free updated COVID-19 vaccine through the Bridge Access program. Adults who may not have the COVID vaccine available to them at 0 cost through insurance are also eligible for vaccine through the Bridge Access program. I'm going to hand it over to Camille.
Thanks, Kate. We can go to the next slide, please. Just a quick intro. My name is Camille Erickson. I'm one of the public health advisors here in the state of Maine. I'm going to just do a quick glance at the Bridge Access program for you folks. There's multiple ways that long-term care facilities can really leverage this program, not only for their patients, but also for their staff. The point of the program is really to ensure that everyone has access to the updated COVID-19 vaccine without any cost sharing, free of charge, basically. So there's a lot of pharmacy chains that are offering Bridge Access program vaccines, such as Walgreens, Shaw's, Hannaford's, Walmart, and CVS. And then there's also smaller, more independent pharmacies, such as just those local community pharmacies who have partnered with eTrue North, which is a pharmacy aggregator. So I believe in the state of Maine, across the entire state, we have about 25 pharmacies that have opted to partner with eTrue North to be able to offer that Bridge Access COVID vaccine as well. And then that is also an option for long-term care facility pharmacies as well. If you do have a pharmacy directly located inside of your facility, then you could potentially partner with eTrue North to have access to that Bridge Access Program vaccine for your patients and for your staff. Finally, you can also pursue just enrolling with the Maine Adult Vaccination Program, which can both give you access to the Bridge Access COVID-19 vaccine, but also all the ACIP recommended vaccines for adults. Next slide, please. There, I'm sure we've all heard a lot of these common misconceptions, and I would urge you to click on that link on the bottom if you're curious to kind of explore some more. But these are some of the top ones we're hearing right now. I think the biggest one that we've all heard is people are still getting COVID even if they've gotten their vaccine, and it's always important to reiterate that the goal of getting the COVID-19 vaccine is really to significantly reduce the severity of the symptoms and the chances of being hospitalized and dying. However, it is still very possible to contract the disease or contract the virus, excuse me. There's, like Dr. Benowitz said, there's no required waiting period between a COVID-19 infection and actually getting the vaccine afterwards. All COVID-19 influenza and RSV vaccines can be administered at the same time at the request of the patients. There's no 2-month waiting period for pharmacies to enter a facility after an outbreak any longer. Also, COVID-19 vaccines do not contain a microchip and they cannot alter your DNA. And again, there's that link at the bottom if you're curious to explore more myths and hear the truths. And then I am passing it on. Oh, if you have any more questions, you can always email us or give us a call. And this is specifically for all adult vaccines.
Hi, everyone. I'm here to provide some highlights about the Power of Care campaign. Next slide, please. So as previously mentioned, the Maine Long-Term Care Ombudsman Program, in partnership with the Maine Health Care Association, is launching the Power of Care campaign. This campaign will focus on supporting long-term care facilities to increase vaccination rates among residents for flu and COVID-19. The campaign will build on the prior success of the staff-focused vaccination campaign, and the campaign will reach residents, their families, and staff where they live and work. We will help overcome barriers to vaccination with this campaign, and the campaign will provide educational materials and will utilize social media to promote the importance of vaccination. And you'll see a link here for mainpowerofcare.com. This is the landing page, and it's very informational. So I highly suggest you visit. And next slide, please. And so this can be a resource for you in your individual facility. So these ambassadors can help carry the campaign message. The ambassadors do receive a stipend per month. And the ambassador provides and shares the information on the importance of vaccination to their peers, residents, and family members. The peer-to-peer model has been successful in distributing information in the prior staff focus campaign, and the facility ambassadors can be beneficial to mobilize your staff to be champions of vaccination. Ambassadors can be your ICP, CRMA, CNA, social worker, or your activities director with one common goal to spread developed materials for the campaign to their residents. This is also an important leadership opportunity for your staff. We've seen in the previous staff vaccination campaign, focused vaccination campaign, that this really helped individuals provide information, but also was a leadership opportunity within for CNAs and CRMAs to work with their ICP closely on the spreading the information of vaccination. And if you're interested in utilizing this resource in your facility, you can reach out to me directly, and my email is provided below. And I'm going to hand this over to Maureen and Elise.
Great, thank you. So just want to kind of circle back and talk with you all a little bit about what we've been hearing from you. Next slide, please. Over the last month or so, many of you have received phone calls, either from myself or from Elise. You may have received some emails or even had some visits. There has been a survey that was sent out electronically from Maine Health Care Association. I really would encourage you, if you have not yet completed that survey, to please complete it. What we have heard is that there had been a lot of questions about the effectiveness, the benefits or adverse effects of the vaccination, including the multiple vaccines. So I know that it's been discussed here that the vaccine does not prevent you from getting the virus, but it does prevent serious complications and death. And maybe before we're done, we can have Dr. Benowitz weigh in on any concerns with having flu, RSV, and COVID vaccines, if there's any time frame between the three of them. We've also heard from you that some of your residents have had some religious or ethical concerns. We know that that is something that, we would encourage your residents to speak with their spiritual advisors about. Really important that they get them involved, because most of your spiritual advisors understand the importance of the vaccine and can help guide their members. A lot of concerns with outbreaks in the facilities. There's been a lot of outbreaks that's caused some delays as far as can we still give the vaccine. I think that's been clarified now. Also caused some shortages of staff to be able to provide a vaccine clinic in some of the centers. Been a lot of concern about personal and facility expense and costs associated with the vaccine. So hopefully now more people are aware of the bridge program, as well as some of the billing issues surrounding the vaccine. We had some who had difficulty getting pharmacy to come on site and to supply and administer, difficulty in organizing some on-site vaccines, and even some difficulty in obtaining a small number of vaccine doses when you just need a couple of those. So those are resources that the Power of Care can also continue to help with in all of your centers. One of the areas that we've heard from a lot of people is the difficulty obtaining family consent when needed for resident vaccinations. And I just want to remind everyone, and Lynn is on the call, that it's important, if you can't get the paper signed, pick up the phone, have a couple of people, have two nurses verify that the family member has given consent. The last thing we want to do is wait. These days, snail mail can be very difficult. So, if you have any questions about that, feel free to ask Lynn while we have her on the call. The other thing is unclear status of vaccinations for new admissions. That I know has been a significant problem for many people, whether it's somebody coming in as a long-term care resident or someone coming in short stay transitional from the hospital, and you don't have that information. So we want to continue to work with our hospital partners to make sure that that information is flowing freely. Really encourage your admission coordinators to talk with the discharge planners to find out about that. Sometimes you may have heard that they had refused it in the hospital. Well, if you're sick in the hospital because you broke your hip and you've had surgery, that may not be the time that you are willing to accept one of those vaccines. Don't let that stop us on our end with trying to encourage residents to get those vaccines once they're a little bit more stable in our rehab centers. The biggest thing that we've heard is vaccine fatigue. So we know that that still is. I can't tell you how many of you have said people are just over it. Well, it would be great if COVID was over us, but it isn't. So we still need to keep going forward, keep encouraging people, keep taking care of our residents and our team members as well as we can. And with that, I'll turn it over to Elise.
Hello, I'm Elise Scala. I'm a geriatric nurse practitioner, and I provided clinical services in skilled rehab and long-term care facilities through the COVID pandemic. And I'm now working with the Ombuds Power of Care program to facilitate vaccination activities. I'm currently working alongside Maureen, doing outreach, making calls to facilities to try and understand what issues are presenting to you, so we can utilize the resources of the Power of Care campaign to help you address them. The campaign is focused on assisting and supporting your organizations to address those barriers and hesitancies and to support resident vaccinations. We're doing that in a few different ways. Nicole talked about the Power of Care ambassador positions. That's a really important facilitator position. You have on-site representation that can work with the Power of Care and help us to address and support your efforts. We want to raise the awareness around vaccine hesitancy by posting quality information, education materials that include social media materials are excellent resources for residents, families, and care staff. We can help arrange vaccination opportunities by talking to resident council, family member councils, and we're happy to assist you in spreading the word and answering questions and addressing the barriers that you've described to us. We can also, in talking with you, help to facilitate communication with other state resources that could help your facility. So please answer our calls or call us so we can help you with your vaccination, education, and administration needs. Thank you. I return to the facilitator.
Okay, so we do have a couple of questions posed. Dina's asking, how can we obtain vaccine status? We have several residents whom we do not have their vaccine history. Impact no longer allows us to obtain this information.
Have you tried looking in Health InfoNet? And Camille, I don't know if maybe you can address, I know that there is a clearinghouse where items, where vaccines are inputted and then residents can individually go in and, or people can individually go in and pull their results. Do you have anything you can add on that?
Yep, there is a link on our website at Maine Immunization Program where a patient is able to request their complete vaccination record that we have on file in Impact, which I can post that link in the chat for you all.
And just to verify on that, it would have to be the individual patient or resident who would go in and get that. Is that correct?
That is correct, I believe, Kate, unless you have any additional information on that.
No, you're correct. It would need to be either the patient or like a power of attorney, somebody that's in charge of their health care.
And Dina, I'm not 100% sure the easiest way. I thought all homes were on Health InfoNet. So I can reach out to you and see what I can do to help you with that.
I don't have any other questions. Is there any other final comments from anyone?
Could I just ask Dr. Benowitz to address the question that I had about the 3 vaccines and any time parameters between them?
Yeah, so I might have mentioned this before, but I'm happy to address it. So, COVID-19 vaccine, influenza vaccine, and RSV vaccine can all be given at the same time. These are all inactive vaccines, so there's no waiting period required. There is a possibility that there will be slightly heightened side effects from getting more than one vaccine at a time, but they still work quite well. And for a lot of patients, you may have one opportunity to offer vaccines to them while it's on their mind or while they're in front of you. Maybe the parameters are a little different in nursing homes than they are in outpatient facilities and hospitals. But when you're going around offering vaccines, all 3 vaccines should be offered to patients who are eligible, and there is no need to wait any period of time in between COVID vaccine, flu vaccine, and RSV vaccine, and also no waiting needed in between COVID infection and COVID vaccine. Maureen, did that hit it, or was there anything else that you wanted to touch on?
Thank you.
Thanks.
One of the things I just wanted to share, as you know, this has been a joint effort. And as we continue to move through the winter respiratory illness season, the Power of Care campaign is really going to be a great resource for everybody. If you don't know who to ask, that is the people to ask. Start off with the Power of Care. Part of the role of this, as Nicole mentioned, is Nicole is really taking the lead of helping to dig out and find the resources. So you may not know where to turn, but the Power of Care campaign can direct you and to help provide those resources. So when you feel like you're emailing everybody and their brother, I would really say reach out to the Power of Care.
Thank you, Maureen. And I just want to mention, there's really a huge benefit to having an ambassador in your facility because we support them. They are able to directly connect with us if they are seeing barriers in their individual facilities. Also, we do a monthly check-in call, which has other ambassadors on the call. Elise and Maureen are able to join that and offer support as they continuously do outreach. And we do end of the month check-in forms. So it really provides a good connection to help overcome any barriers and provide additional education.
Any other questions or comments?
Maureen, this is Elise. Would you mind going over what the vaccination reporting process is and what facilities need to do to provide us with information on how they're doing?
Sure. Actually, Carrie may be able to do that a little more easily. That is all done through the NHSN. Carrie, is that something you can speak to readily?
Not as readily as I used to. I haven't been involved in reporting quite as much as recent, but yes, if you are a CMS certified facility, then there is reporting through NHSN. If you're not a CMS CMS certified facility, then I will have to circle back to see exactly what is the current requirements for that. But I can go and grab into the chat the protocols and the information for that. And I can, if you're following up with slides on this, I can get some language for you to send out to the group.
And it is, so that everyone knows, it is now reportable on the CMS Nursing Home Compare or just Care Compare now, that the rates of both your residents and your staff up-to-date status is now being reported publicly there. Anything else that people want to bring up today? Not, I'll turn it back over to Karen.
All right, so I just had one comment, I think, from Lindsay. She would just like to note that recent data and polling shows that healthcare providers are the most trusted voices, particularly for those who are hesitant about getting the COVID vaccine. So it's really important that we have providers help in carrying that message to patients and residents in facilities, as well as carrying that message to the workers in these facilities. I think that was about the last comment or question. So if you have anybody have any final words for our audience?
I would just say, having walked in your shoes, we all know what it's those of us who've been in the homes during the pandemic know how torturous it was. And the one thing that we can do is we can encourage people to get vaccinated. And the more we do that, look at the difference from at the height of the pandemic when our residents were dying. Yes, they're still getting sick, and yes, some are still dying, but not as it was pre-vaccination. So please, 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 please really consider, encourage, and do everything you can to help our most vulnerable population get the care that they deserve. Thank you.
Thank you for joining us, everyone. We just really appreciate you being on the call. We will do, happy to do a follow-up email to folks to give you a copy of the slides. If you have any final questions, please don't hesitate to reach out to us. and we'll try to get you answers to your questions as soon as possible. So without further delay, we'll just hope you have a great afternoon.